Have you ever stopped to think about how often seniors should actually shower? It's easy to assume that everyone needs a shower every single day, right? But what if the answer to this common question isn't as straightforward as we think? Today, we're going to dive deep into the habits of seniors when it comes to showering, and you might be surprised by what we uncover. We're peeling back the curtain on a well-known belief that daily showers are essential for everyone. Stick with us as we reveal the truth that could make you reconsider the way you think about hygiene, cleanliness, and health, especially when it comes to our senior loved ones. Let's begin by considering how ingrained the idea of daily showering is in most of us. We've all been raised with the belief that showering every day is a non-negotiable part of life. It's as familiar as waking up in the morning, having a cup of coffee, or catching up on the latest news. Showering has become something that is deeply embedded into our daily routine. It's a moment that refreshes us, making us feel clean, energized, and ready to face the day. There's nothing quite like stepping out of the shower, with water droplets still clinging to your skin and the scent of soap lingering in the air. But what if this belief, the idea that everyone, regardless of age, needs a shower every day, is actually causing more harm than good for certain people, especially seniors? Now, I'm sure you're thinking, cleanliness is essential, right? And absolutely, hygiene is important. But let's take a moment to think critically about this. Could we have been conditioned to believe that we need to shower daily to be truly clean? Could it be that we've been led to equate cleanliness with frequency? The truth is, as we age, our bodies change, and so do our skin's needs. Seniors often experience more delicate and sensitive skin, which can be easily affected by frequent showers. The hot water, soap, and constant washing can strip away the natural oils that our skin needs to stay moisturized, which can result in dry, irritated, and itchy skin. This may not seem like a big issue at first, but for seniors, these small effects can lead to larger, more serious health concerns like infections or skin conditions. So, maybe showering every day isn't the best choice for everyone, especially when it could lead to more harm than good. Numerous studies have looked into the effects of showering on skin health, particularly for seniors. For example, research conducted by the University of Pittsburgh found that the skin of seniors is thinner and more fragile than that of younger adults, which makes it more prone to damage, especially with frequent showers. Their skin is already more delicate and less able to retain moisture. When showering is done too often, it can strip away natural oils that protect the skin, leaving it vulnerable to dryness, cracks, and even infections. Similarly, a study from the University of California, San Francisco, revealed that hot showers, in particular, exacerbate skin dryness, which leads to the development of xerosis, a condition marked by flaky, rough, and itchy skin. The New England Journal of Medicine also found that seniors who showered less frequently experienced fewer skin tears, painful, slow-healing injuries that can lead to infection. The bottom line is that showering every day might not be the best approach for seniors. As we've seen, their skin tends to be more delicate, and frequent showers can result in dryness, irritation, and even infections. So what's the alternative? Experts recommend that seniors shower less frequently, depending on their health conditions and level of physical activity. This can mean showering every other day, twice a week, or even less. While this might seem surprising, it's crucial to understand that everyone's body is different, and what works for one person may not work for another. For some seniors, showering once or twice a week is enough to maintain good hygiene without harming their skin or putting them at risk for falls or other injuries. Another important consideration is the safety risks that come with showering. Bathrooms, especially showers, can be hazardous spaces. They're often slippery, and seniors, who may already struggle with balance and mobility issues, are at greater risk of falling. Falls are one of the leading causes of injury in older adults, and the bathroom is often where these accidents occur. According to the Centers for Disease Control and Prevention, nearly 1/3 of adults over the age of 65 experience a fall each year, with a significant number of these falls happening in the bathroom. By reducing the number of showers seniors take, we can decrease their exposure to these dangerous situations. This can be especially helpful for seniors who have trouble getting in and out of the shower or standing for long periods. Showering less often can help reduce their risk of slipping and falling, keeping them safer in the long run. Showering can also be physically demanding for some seniors. The act of standing in the shower, washing, and rinsing can leave seniors feeling fatigued, especially if they have certain health conditions, such as heart disease or respiratory issues. The American Medical Association points out that for some seniors, the act of showering can lead to shortness of breath, exhaustion, and discomfort. For seniors with chronic conditions, it's important to consider whether showering every day is too strenuous for them. Sometimes, a less frequent showering schedule can be a safer and more comfortable alternative that doesn't put additional strain on their bodies. This can improve their overall well-being and prevent unnecessary fatigue. So, you might be wondering, how often should seniors actually shower? The truth might shock you. Many experts recommend showering only once or twice a week for most seniors. Yes, you heard that right, once or twice a week. Of course, this depends on individual factors, such as health conditions, mobility, and lifestyle. For seniors with less physical activity, showering that frequently is often more than enough to maintain good hygiene. The key is to find a balance between cleanliness and the needs of the skin. Overshowering, particularly with hot water, can strip the skin of its natural oils, which are essential for keeping the skin moisturized and protected. So, showering less often can actually help preserve the skin's natural defenses and prevent the development of painful conditions like dry skin or infections. As we age, our skin naturally becomes thinner and less oily. These changes make the skin more susceptible to dryness, irritation, and infection. Showering too frequently can accelerate this process by removing the oils that help keep the skin moisturized. In fact, when seniors shower too often, especially with hot water, they can exacerbate the effects of aging skin. This is particularly problematic for those who are already dealing with skin conditions like eczema or psoriasis. It's important to understand that less frequent showers can help reduce these risks and promote better skin health. Keeping the skin's natural oils intact is crucial for preventing issues such as cracking, which can lead to infections. Beyond skin health, one of the major reasons for recommending less frequent showers for seniors is safety. The bathroom can be a hazardous environment, particularly for those with limited mobility or balance issues. Wet, slippery floors increase the risk of falls, an issue that is all too common among older adults. Falls in the bathroom can result in serious injuries, such as fractures or head trauma. The Centers for Disease Control and Prevention, CDC, reports that approximately 1 in 3 adults over the age of 65 will experience a fall each year, and many of these accidents happen in the bathroom. Reducing the frequency of showers can help minimize exposure to these dangerous situations, especially for those who are at a higher risk of falling. Showering less frequently can lower the chances of slipping and falling, helping seniors stay safer in their homes. Mobility plays a significant role in determining how often seniors should shower. For many seniors, getting in and out of the shower or standing for long periods of time can be difficult or even painful. Seniors with arthritis, joint pain, or muscle weakness may find it especially challenging to shower daily. In these cases, the effort and physical strain required to shower every day can actually be harmful. Showering less frequently can alleviate some of this physical burden, helping seniors avoid exhaustion or unnecessary strain on their bodies. For seniors who experience difficulty standing or moving around, taking fewer showers may be the safer and more practical option. It's important to remember that our bodies have natural ways of staying clean. The skin produces natural oils and bacteria that help protect it from harmful microorganisms. Showering too frequently can interfere with these natural processes, stripping the skin of beneficial bacteria that are essential for maintaining good skin health. Overshowering can also disrupt the skin's protective barrier, leaving it vulnerable to infections and other problems. Seniors, in particular, benefit from showering less frequently, as their skin is more sensitive and prone to damage. Giving the skin time to replenish its natural oils and bacteria can actually promote better hygiene and skin health. For seniors who find daily showers too taxing or difficult, there are plenty of alternatives to maintain good hygiene without the need for a shower every day. One great option is the use of wet wipes. These wipes are not just for babies. They are a fantastic tool for seniors who may have trouble showering daily. Wet wipes are gentle on the skin and can be used to clean the face, hands, and body, offering a quick and convenient way to freshen up without the need for a full shower. When choosing wet wipes, It's important to select ones that are unscented and hypoallergenic to avoid skin irritation. These wipes can be used anytime, anywhere, providing seniors with a practical solution to stay clean throughout the day. Another crucial aspect of hygiene is hand washing. Washing hands regularly is one of the simplest and most effective ways to prevent the spread of bacteria and viruses. For seniors, especially those who are more vulnerable to illness, keeping hands clean is vital. It's recommended to wash hands with soap and warm water for at least 20 seconds, ensuring that all areas, including the back of the hands and under the nails, are properly cleaned. When soap and water aren't available, hand sanitizer can be used as a backup to help prevent the spread of germs. Regular hand washing is a key part of maintaining hygiene and preventing infections, even when showering is not done daily. Taking care of your teeth and gums is just as important as maintaining clean skin. Seniors should aim to brush their teeth at least twice a day and floss regularly to prevent oral health problems, such as cavities and gum disease. Good oral hygiene is linked to overall health, as poor dental care can contribute to various health issues, including heart disease and diabetes. For seniors who may have difficulty brushing, alternatives like mouthwash or no-rinse oral cleaners can be used to help keep the mouth clean and fresh. Maintaining proper oral hygiene can help seniors feel better and more comfortable, and it's an important part of self-care. So, what's the bottom line? Showering frequency isn't just about following a societal norm. It's about taking the time to consider what's best for each individual's health and well-being. For seniors, showering less frequently can actually improve skin health, reduce the risk of falls, and prevent fatigue. By considering alternative methods like using wet wipes, washing hands regularly, and maintaining oral hygiene, seniors can keep clean without needing a daily shower. The key is to find a routine that works for each senior, taking into account their specific health needs, lifestyle, and preferences. Whether it's showering once a week or using other methods of maintaining cleanliness, the most important thing is that seniors feel comfortable, healthy, and safe. The truth is, there's no one-size-fits-all answer when it comes to showering. It's all about balance.